Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center, Caring Medical in Fort Myers, Florida. I'm commonly asked, what are the 3 key points in recognizing and resolving chronic joint pain? So I just wanted to really quickly, just the highlights of what I think you need to do to get rid of chronic joint pain. Early in my career, I got hired by Dr. Hummel. He was 85 and I was 30. This would have been 1993. 30 years ago. So he said, Ross, chronic pain's from the ligaments. So point number 1 is chronic pain is from the ligaments. If you have chronic pain, it's likely you have a structural injury. So you have chronic low back pain. You have ligament damage in your lower back. And the way you find the ligament damage in your lower back is you have to have a motion scan. You have to have some kind of scan where you're moving. So that's called motion X-ray or fluoroscopy. So that's what we do in the office here. Most of the nerve endings in the joints are in the ligaments. So that's a key point. The nerve endings that give pain, that give joint pain, are within the ligaments. What tells the brain what the joint is doing in 3D space, so you're playing soccer. So what's telling the brain that your knee's in the right position or da-da-da? It's the motion sensors, the nerves in your ligaments. So if a ligament is stretched too much, the nerves within the ligaments are stretched, and that's what gives pain. So they give pain, then they send off nerve impulses to the muscles, so that's what gives the muscle tension that grabs. Like, you see athletes sometimes grab, at the knee or this or that. So that acute muscle tension is the muscle is tensing so you don't tear the ligament or you don't dislocate the joint. Ligament damage affects all the tissues of the joint because ligament injury means that the bones are going to move in excessive ways. And the excessive waves lead to excessive pressure in the joints, and the excessive pressure in the joint leads to cellular, micro, and tissue macro damage. Meaning that what causes the breakdown or degeneration in a joint is excessive pressure. The excessive pressure occurs because there's extra motion, and the extra motion occurs because of ligament dysfunction. So the treatment of degenerative joint disease, degenerative disc disease, arthritis should be directed at the ligaments, and the treatment directed at the ligament dysfunction is prolotherapy. Prolotherapy stimulates the ligaments to get stronger, tighter, thicker, and it resolves joint instability. So understand ligament joint instability is the number 1 principle to get rid of chronic joint pain. Number 2, understand the cause of degenerative arthritis, which I just said. Joint gangrene cascade. The progressive degenerative arthritic process leads to whole joint organ gangrene when the initial ligament injury and its resultant joint instability are not corrected. You get a ligament injury, eventually the body will swell the joint to stabilize the joint. Eventually you get lesions in the bone, and this is just example of a knee joint. So the meniscus is going to lose cells, the meniscus is going to get degenerated, basically gangrene, right? The cells die. So when you have ligament injury of the knee, you're going to get the meniscus cells die, the cartilage cells die, the ligament cells die, the tendon cells die, which gives what? Ligamentosis, which is a degenerated ligament, tendinosis, degenerated tendon, cracks in the cartilage. Basically what ends up happening is you get massive joint organ cell death, which we know as osteoarthritis. So if the ligament injury is not treated, the degenerative process accelerates and you end up getting all the structures in the joint get affected. Now the third thing to understand is prolotherapy, because if to get rid of chronic pain you have to understand that you have ligament damage, then that ligament damage causes all the cells in the joint to get gangrenous, to the cells die, then eventually the tissue gets weak. You end up having tendinosis, which is degenerated tendon, so the tendon's weaker, so eventually you end up with tendon tears. Ligamentosis, degenerated ligaments, you end up with ligament tears. Meniscus degeneration, so you end up with meniscal tears. The shoulder and the hip have a labrum, so you end up with labral tears. in the low back or the spine, you get what? Degenerated discs, and then you get tears in the disc. So that it's all because of ligament injury. Then the treatment of ligament injury is prolotherapy. So the third principle or thing that a person needs to learn is, what is prolotherapy? Prolotherapy is the injection of a proliferant into injured tissues for the purpose of repairing it so its function is restored. Another way to think about it is prolotherapy is an injection technique used to resolve joint instability by causing thickening and tightening of the injured ligaments so they are strengthened enough so the bones they hold together move correctly. That's it. Once the bones move correctly, the pressure on the structures of the joint, the cartilage, the bone, the subchondral bone, the bone marrow, the meniscus, the labrum, the cartilage, the ligaments, tendons, the pressure is all normal. Then, dude, you can go run, you can go jump, you can, because people ask me like, Doc, come on, what's the future look like? And I'm just telling you, man, if you understand these principles, the future looks really bright.